Hi, I'm Shannon Rodriguez, Telemetry and Coumadin Team Leader at Cardiovascular Institute of the South. If you're watching today, then you are most likely prescribed Coumadin, Warfarin, or Jantoven. For the sake of this video, we will use the term Warfarin to reference the medication. We will discuss Warfarin therapy and INR management. Warfarin is an anticoagulant medication, commonly known as blood thinner, given to prevent or reduce coagulation of blood, therefore prolonging the blood clotting time. If blood is too thick and forms clots, then you can be at risk for heart attacks, strokes, or other serious medical conditions. Warfarin helps your blood to flow more easily. Reasons why patients are on Warfarin depend on each patient's health condition or disease process. Your physician has determined that Warfarin is the best choice for you at this time. You will have access to a Warfarin nurse during your Warfarin therapy. There are a variety of printed materials that we can share with you or send to you via the CIS patient portal. You can ask at your next clinic appointment how we can get you set up for the portal if you have not done so. Warfarin works by decreasing the amount of clotting factors found in the blood, which then decreases your chance of a blood clot forming. Warfarin will not shrink blood clots that are already there, but it will prevent those from getting bigger and keep new ones from forming. If you have existing clots, your physician can monitor that with ultrasound. Warfarin therapy is monitored by obtaining a blood sample and performing a PT-INR level. PT-INR, or prothrombin time international normalized ratio, is basically the number of seconds it takes for your blood to clot. Your CIS provider will get your target INR set depending on your disease process or reason why you are taking Warfarin. CIS has a trained Warfarin team that will adjust your Warfarin dose according to your provider's orders, INR result, and your goal range. Your provider and Warfarin nurse will discuss that INR goal range with you. Not every patient will have the same goal. When started on Warfarin, you will be asked to check your PT-INR once or twice the first week. As your INR level gets closer to your goal range, we can check your INR once a week and eventually 2 to 4 weeks if the INR is maintained in that goal range. If your INR becomes out of range, then your testing may be more frequent until we can get you back in range. Warfarin pill colors are the same for every U.S. manufacturer. The milligram strength will always be the same color if refilled with a U.S. manufactured tablet. For example, if you have a 5 milligram Warfarin tablet, then the color should be peach if the pharmacy filled your prescription with a U.S. manufacturer. Let your pharmacist and/or Warfarin nurse know if your pill color changes so we can verify what you were given was actually what was prescribed to you. We ask that you take Warfarin at the same time each day, preferably in the evenings, in case an adjustment to your medication is needed. This allows time for your nurse to get your INR result, consult with your provider, and call with dosing instructions. Take your medication as instructed and not what your bottle says, as if your medication was refilled, you may have had some dosage changes since then. Never run out of your medication. Call for your refill about a week before running out if your insurance will allow. If you are going on a trip, please make sure to bring enough medication with you for the trip and some extra in case the trip is extended. If you miss a dose of Warfarin and you notice on the same day, then you may take that missed dose. If you miss a dose and realize on the following day, do not double the dose. Call your Warfarin team for further instructions. Using a pill planner just for Warfarin may help you to keep track each day, as well as setting an alarm or putting a reminder on your bathroom mirror. You may be thinking, how long do I have to be on Warfarin? Normally, you will stay on this medication as long as you have the disease process or condition that has caused your body to create blood clots. If at any time that condition is resolved, your physician will further direct you. It is very important to let all of your other doctors know that you are on Warfarin therapy. This can alter how they treat you and the medications they prescribe to you. There are some normal and abnormal side effects of Warfarin. Normal side effects may include some bruising, small amounts of bleeding from the gums when you're brushing your teeth, or from cuts or scrapes. You may also have some blood mixed with mucus when blowing your nose. These are normal. What should you do if bleeding is not an emergency? You can contact your CIS Warfarin team and they can give you instructions or make an appointment if necessary. What is not normal to have excessive bruising without an injury? If you wake up and notice a huge bruise to your thigh that you did not have when you went to bed and are sure you did not bump your leg into anything, then that may lead to an issue that would need addressing. If you experience heavy nosebleeds, blood in your urine or stool, coughing up blood, prolonged bleeding from cuts or scrapes, gums bleeding when you are not brushing your teeth, then you need to call your Warfarin team for direction. If you have any significant history of bleeding, please let your physician and a Warfarin team member know. If you experience a large amount of bruising or bleeding that is not resolving, please go to the nearest emergency room for evaluation and treatment. Your dose of warfarin is not determined by age or weight. It is determined by your body metabolism and genetics, so it may take several weeks or months to find the best dose for you. When we get your INR readings, the Warfarin team will give you the medication dosage according to that INR, keeping in mind any changes to your recent diet, medications, any increased bleeding, or if you've had any recent illness. If your INR is too high, then we may decrease your warfarin dose, and if too low, we may increase your dose. If you have an INR scheduled, please keep those appointments so we can better regulate your medication. If you don't keep those appointments, you can possibly increase your chances of bleeding or forming blood clots. We cannot adjust your warfarin dose without a current INR. Always call your warfarin nurse if you must miss an appointment so we can get you rescheduled. If you had a home health nurse drawing your PT INRs and you get discharged from home health, please notify your CIS Warfarin team so we can get you scheduled elsewhere. Communication between you and your Warfarin team will be the key to your success while taking warfarin. There are many things that can affect your warfarin therapy and your INR. Some things, such as medications, over-the-counter and prescribed, prolonged illnesses such as vomiting, diarrhea, or fever, fluid overload, diet changes, and the vitamin K intake in your diet, lifestyle changes, exercising, alcohol intake, skipping warfarin doses, missing INR appointments, and running out of medication can also affect your INR and warfarin therapy, which again will increase your risk of bleeding or forming clots. Let's review how your diet can affect your INR. Vitamin K changes the way warfarin affects the blood. When you eat foods that are high in vitamin K, you can decrease the effects of warfarin. Eating less vitamin K can increase the effect of the medication as well. Vitamin K can be found most commonly in green vegetables, but it is also in a variety of other foods. The key is to eat a consistent amount of vitamin K foods from week to week. For example, if you are currently eating 1 serving of green vegetables daily, then we want you to continue that if you choose. If you are eating greens 2 to 3 times a week, then continue. If at any time your diet changes or you decide you need to change those habits, let your warfarin team know because they may need to adjust your weekly warfarin dose. Let me give you a scenario. If you eat double the green vegetables this week than you normally eat, your blood will be thicker and your INR will be lower because you ate more vitamin K than usual. If you normally eat 3 servings a week, but this week you were on vacation and ate none, then your blood would probably be thinner and your INR higher because you were taking a warfarin dose to accommodate those greens in your diet. This is why vitamin K consistency is key from week to week. CIS will provide you with a list of foods and the amount of vitamin K in each serving so you can use that guide to stay consistent. The list will show low, medium, high content of vitamin K in each serving size. Try to keep items such as low sodium VA juice, grapes, blackberries, blueberries handy in case we ask you to have an extra serving of vitamin K food if your INR is elevated. Illnesses such as prolonged vomiting, diarrhea, or fever can alter your metabolism, which can cause your INR to fluctuate. If any of these occur, notify your warfarin team so we can adjust your warfarin dose accordingly to fit your metabolism, or we can check your INR sooner than scheduled if needed. Some medications can affect your INR levels. There are many medications, both over-the-counter and prescribed, that will affect your INR. We do not expect you to remember all of them, but there are certain categories of medications such as antibiotics, anti-inflammatories, cholesterol medications, thyroid hormones, antidepressants, antifungal medications, antiplatelets such as aspirin or Plavix, dietary supplements like Ensure or Boost or Glucerna, herbals, and vitamins that can commonly interact with warfarin. If you start any of these mentioned, please notify your warfarin team within 24 hours. These can cause your INR to fluctuate. In most cases, if you are started on any of these medications, we will check your INR within 3 to 5 days. For normal aches and pains, we suggest you take Tylenol. It is safe to take 1 to 2 tabs once or twice a day, but if you feel like you need more, please notify your warfarin team, as this may affect your INR. For constipation, we suggest taking Metamucil or milk of magnesia. Remember to drink water with those, of course. For colds, plain Sudafed or original Benadryl is okay if approved by your cardiologist, and original Robitussin for cough. The most important thing to remember is to notify your warfarin team if you begin any new medication, either over-the-counter or prescribed. Lifestyle changes can affect your INR, such as an exercise routine, which can alter your body metabolism. If you currently have an exercise routine, then continue that routine. But if you get injured or ill and cannot continue exercising, please notify your warfarin team so we can closely monitor your INR to adjust your warfarin as needed. If you are not exercising routinely, but begin some sort of exercise program, again, notify your warfarin team. Drinking alcohol can cause your PT-INR to go up. We suggest if you drink alcohol, then do it occasionally. It may be safe to have a serving or two in a 24-hour period, but not safe to have more than that. When we speak of a serving, we mean, for example, a 12-ounce can of beer, 4-ounce glass of wine, or 1.5-ounce shot of liquor. It is also not safe to binge drink alcohol. Alcohol is a normal blood thinner, as it can cause your body to make fewer platelets than normal, which are the cells in your body that start the clotting process. So if you drink alcohol with warfarin, your blood can become thinner, increasing your INR and your bleeding risk. Notify your warfarin team if you change the amount of alcohol you routinely drink. CIS suggests you keep an ID card, a medic alert key tag, or a bracelet noting that you are a warfarin patient, so emergency personnel can identify you immediately. We don't suggest only putting warfarin, as it can be mistaken for an allergy. Safety with warfarin therapy. Be cautious around sharp objects. Wear shoes at all times. Avoid any rough contact sports. Wear long sleeves when out in the yard or working, and try to avoid climbing. All will help to reduce the risk of bruising or bleeding complications. Once you have been on warfarin and managed by the CIS warfarin team for at least 90 days, you may qualify for INR home monitoring. This, of course, will be subject to your insurance requirements. Home monitoring has been shown to be beneficial to so many of our patients. You can test your INR in the comfort of your own home and will not have to go to an outpatient lab for testing or even rely on transportation. This home monitor is a meter similar to the meters that test for blood sugar. Once approved by your insurance and authorized by you, the company will ship you out the meter and then schedule your training so you feel more comfortable with testing at home. Don't worry, if you have poor eyesight, arthritis to your hands, or some other condition that would hinder you from self-testing, you can get a caregiver who can test your INR for you. We suggest you check your INR on the home monitor between the times of 7 a.m. and 3 p.m. Monday through Friday. Once you get the result, you would either call an 800 number and give the result, or add the result to an app on your phone. Either way, your CIS warfarin team will get that result and call you with dosing instructions, making it easy and convenient for you. Thank you for taking the time to learn how to manage your INR levels. You are the most important person that can contribute to your health. If you have others who are administering your medications or who do the cooking for you, consider sharing this video with them as well. If you have any questions, please ask your Warfarin team the next time you speak to them or your CIS provider on your next clinic visit. We are here to help you succeed and will work with you to help decrease the risk and complications that come with Warfarin. Your health is important to us and your safety is critical. Thanks for entrusting your health care to Cardiovascular Institute of the South.